it's a doom and gloom type of story, but the reason we talk about it is so we can prevent this doom and gloom from coming to fruition. And the concern I have with Alzheimer's is that the cases of Alzheimer's will triple by 2060. That is huge. For all you nurses out there that take care of patients that have dementia, you know, I know, we all know that taking care of someone that has dementia is not a single person's nurse's job. It's not just a care team's job. It's not just a family. It is everybody. It takes it takes a lot to take care of someone with Alzheimer's, especially towards the end stages of Alzheimer's. It's a horrible disease. We don't have a cure for it, and the numbers are just going to go higher and higher and higher, and they are going to affect specific populations worse than others. So right now, there's about 5 million people in America that have Alzheimer's, which is about 1.5% of the population, right? That's a lot. 5 million is a goddamn lot of people. But I said triple. But by 2060, that number will hit nearly 14 million, which will be about 3.3% of the population. That is huge. That is huge, right? That is an insane amount of people. And yes, that is a drastic increase, and it's not so much that that it's, oh my goodness, more people are getting Alzheimer's. It's not that. It's that there's just a lot more people in America, and the population continues to grow. And if you just projections, the numbers will continue to grow. The U.S. population of persons aged 65 years and above is expected to double from 46.5 million in 2014 to 83.7 million by 2060. So I did tell you at the beginning of the segment that more people were going to have Alzheimer's, and it's going to affect specific populations harder. So African Americans have the highest percentage of Alzheimer's by the population, with 13.8% of blacks age 65 or older who are affected. More than 12% of Hispanics have Alzheimer's, and 10% of whites that are over the age of 65 and older. And the reason I bring this up, is not to just throw shade out there and put the negativity out there and have you scared and, you know, write your will so you get euthanized at the age of 65. No, I'm not trying to scare you. Right? It's a PSA. It's a public service announcement. I'm just here to let you know what the projections say and what you can do now to make that future a little bit better for yourself and for your family and for the whole of the US of A. So it's not as scary when it actually happens, if it actually happens. Because if you're a nurse, if you work in healthcare, you know that there is no cure for Alzheimer's. There is no treatment for Alzheimer's. The best we can do right now, the best we can do is take meds and help slow the progression. That's all we can do right now. There is no cure. There is no treatment. There is no reversal. Right now, it is live as healthy as you can, take medication so we can stop the progression. And the reason I'm going to end it on this. The best way to treat or slow the progression of your Alzheimer's is to get checked, to get your yearly physical. If you have any questions, if you have a family member that is forgetful, that has changed, their mental status is a little off, any reason you might think that Alzheimer's or any mental disorder is happening, do not brush it off as, oh, that's just, mom she just turned 65. Well, grandma just turned 72. Go get checked it out. The sooner you check it out, the better they can jump on it and slow that progression. And that's what we want. That's the entire reason I went through this whole rant. Yes, 2060 is going to be a whole lot more people with Alzheimer's, but if you continue to get checked up, if you continue, and with the technology and the amount of research that's going into this, hopefully by then, knock on wood, and I'm not just telling you, I'm saying it to you and reminding the world, and myself included, because in 2060 will be the year I turn 65. And like I told you, blacks are the highest percentage of people 65 and older that have Alzheimer's. This is for all of us, myself included. So just letting y'all know, for a better future, go get your checkup. If you know anyone, if you have any concerns with anyone that's close to you, that's in your family, please tell them to go get checked out, because it's important. And Alzheimer's, we don't have a treatment, we don't have a cure. Thank you guys so much for watching. I really do appreciate this. If you guys were informed or educated in any way, shape, or form by these stories, please hit that like button. If you liked my presentation of the news, I really suggest you subscribe and hit the notification bell so you know every time Q the Nurse drops some hot, fresh press news. Thank you. Catch you next week. Deuces.